Today we're going to learn a serratus anterior plane block in under a minute. Let's get started. You're going to use the linear probe and place it in the axilla of the patient in the parasagittal plane, and you're going to put the probe on the patient's body in a transverse manner. Ideally, this should be over the fifth rib, which is going to coincide roughly to the nipple in the male patient and the inframammary fold in the female patient. You are supposed to visualize the latissimus dorsi superiorly. Under that, you will see the serratus anterior muscle, and inferior to that, you will see the ribs and the pleura. Ideally, what you need to do is you need to pierce the latissimus dorsi, you need to come under it, and you need to get to the serratus anterior plane muscle. You can either inject your local anesthetic superior to the serratus anterior muscle or inferior to it. There is no evidence that the superficial approach is superior to the deep approach or vice versa. Once you are in the correct space, ideally you should use a volume of 20 mils of whatever local anesthetic you're using, and make sure that you don't go over the toxic dose that is allowed for the patient with the local anesthetic. In my opinion, this is a very safe block because you are quite far away from the pleura to be able to cause a pneumothorax, and you are targeting a bone. This is a diagram of which region the serratus anterior plane block covers. The most important thing with this block is to avoid the thoracodorsal artery that sits between the latissimus dorsi and the serratus anterior muscle. That's all for today. Make sure you try this block on patients with rib fractures who need analgesia. Thank you so much.